All right, good morning, everybody. We're going to get started. We're still working on getting the PowerPoint uploaded, but that's not going to prohibit us from moving forward and keeping everybody on track. I want to thank everybody for being here this morning. Thank you for joining us for our breakfast briefing. We haven't had a breakfast briefing for a while. As many of you know, with COVID-19, getting together on Friday mornings for breakfast and education and learning was not allowed. But we know how important this is to the community, and we know how important this is to our membership. So we want to make sure we're continuing to bring high quality programming to you to discuss important issues at hand. And I'm excited today to have our healthcare panelists here to talk about really the state of the healthcare in the region and what they're doing for the business community. Before we get started, though, I just want to take a moment and discuss an issue of importance to the chamber, our community, and the world. We've long known that systemic racism has resulted in inequities in our communities, here in Dayton and across the country. The tragic death of George Floyd brought us to a national turning point. It really did. And we got to tear down those longstanding policies and practices now. Saying we're against racism is the right thing to say, but all of us have to dig deeper and challenge ourselves to identify the tangible action we as businesses and individuals can take to address the injustice. Over the past few days, the Chamber's been working closely with our local government and state officials on this issue, but we know more needs to be done. Now's the time for change, and the Dayton Area Chamber of Commerce stands ready to learn, evolve, and lead the business community on this critical issue. Look for more information that the Chamber is going to be sending out here shortly in the next week or so on this issue. Thank you all for allowing me the time to really have that reflection, but I think it's important, and it's important that we continue to address this critical issue for the community. Now, moving forward, we want to jump in and recognize our sponsors today who made this program available to everyone. As we know, normally there's a cost, but thanks to our sponsors and thanks to us not having to provide breakfast to everybody, we're able to provide this as a complimentary event for our members. I want to thank CareWorks, who's our presenting sponsor. Julia Bowling and Ken Main are on the call with us today. Thank you, Julia and Ken, for your support. Benefits Network Insurance, Division of Risk Strategies. Anthony Sucato is with us today. Anthony, thank you for your support of the Chamber and especially of our healthcare insurance program. And then Pickrell, Schaefer, and Epling. Picker and Schaefer and Epling's with us today, and Mike Sandner is here. And actually, we're gonna, Pickrell, Schaefer, and Epling, our sponsor, we're gonna highlight this month's breakfast briefing. So I am going to turn it over to Mike Sandner, president of Pickrell, Schaefer, and Epling, to say a few words as this month's featured sponsor. Mike, it's over to you. Mike, I can't tell if you're on mute or. Okay, we might be having a little technical difficulties on the mute. So Mike, promise I'm gonna come back to you. We're gonna keep moving forward, and I'll try to circle back as we get that worked out. Regarding our webinar logistics, just want to remind everybody that today's event is being recorded, and we will have access to that recording and email it out after the event. We will also be taking questions at the conclusion of the speaker portion of this event. There's a question option box. If you look over on my screen, it's on the right side. You're going to see a tab that says questions. That is for you to pose questions to the speakers. Those questions will go to me, and then we will pose them to the speakers at the end of their presentation. So if you have any questions, feel free to put any appropriate questions in that box, and we'll review them and make sure the speakers get them. If we can't get to all the questions, we'll send it to the speakers afterwards to let them answer them how they feel appropriate. Additionally, we did not see any media on this call, but I wanted to make a note that this is a private event. Any media on the call that has made it on the call would need to get permission from the chamber and the speakers before being able to use any of the information in today's call as a source for any upcoming articles or TV shows. So with that being said, I'm going to introduce our speaker panel. We have a great speaker panel today. I'm excited about our healthcare leaders that are with us today. All of them are going to have a different perspective that they're going to be able to relay to you about how they've adapted, they've changed. The word pivot has been used way too much lately, but it's what all of us are doing, is pivoting and changing and trying to adapt to this environment. So I'm excited that we have this great panel of speakers here with us today. We've got Mary Boosalis, President and CEO of the Premier Health Network, Debbie Feldman, President and CEO of Dayton Children's Hospital, and Fred Manchur, CEO of the Kettering Health Network. So welcome to all three of you. We are going to allow each one 5 minutes to say a few words about how their organization has adapted and changed and is going to be helping to serve the business community. And then we're going to jump into some Q&A and go from there. So with that being said, Mary, I'm going to ask you first. I guess I should disclose this so everybody knows. Mary, I'll ask you first, then Debbie, I'll ask you second, and Fred third. Give about 5 minutes of remarks about how your organization has changed and adapted. So Mary, we're going to start with you first, and hopefully our mics are working, and I'll turn it over to you right now.
Thank you, Chris. Can you hear me okay? Appreciate it.
I can, thank you.
All right, and I appreciate the opportunity to participate today. And thank you for calling out the horrific murder of George Floyd. You know, Premier's had a long history of commitment to diversity and inclusion, but we want to join others in addressing such disturbing patterns of injustice in this country. So I think it's important that we all work together on these innumerable issues. In terms of adjusting to the pandemic, I think AKA the new normal, and we're not really through the pandemic yet, it was probably like many of your companies out there. First and foremost, we wanted to make sure our customers, in our case, our patients and our staffs, were safe, particularly our frontline caregivers, who I believe are the true heroes of this pandemic. I'd like to think we're all Zoom certified because we literally had to leap across the digital divide. While Premier's had e-visits and televisits and video visits for some time, we saw a 2,000% increase in telemedicine visits. So, in going forward, it will be interesting to see how, again, our customers continue or whether they prefer to see physicians, et cetera, in person. I think we've all found out, and I'll tell you, maybe I didn't appreciate this as much as I do now, that we can work at home productively. And like many others, we're looking at who works at home on an ongoing basis, what are the criteria, what is the impact of that on various real estate and office functions. I think something that all three of us are probably proud with, and we heard a lot from the Ohio Hospital Association, we collaborated very well at the local and state level in planning for the worst in terms of the incidence of COVID. And I think many of you know from the press, Ohio really did flatten the curve by doing what the governor and the state health department director asked of us. I think one hallmark for us was we communicated internally and externally. I think a lot of you saw the clinicians on the news everywhere, and I think that's important because what's unique about COVID are the unknowns, and when people don't know, they become afraid. So probably more than ever, and on a go-forward, communication, at the risk of stating the obvious, is key. You know, I think in a funny way, I don't know if it's not funny, haha, but having been through the tornadoes, the mass shootings, and the abrupt onset of COVID, I actually believe, particularly, I think, given the level 1 history of the Valley, we're almost at our best in a crisis. I don't wish a crisis on anyone, but what we stood up a virtual command center in a matter of hours that I would say rivals any and runs like clockwork to this day. We found out, I think, as an industry, and when you're a big company, it's more challenging, but that we can move with nimbleness and innovation. Chris, you and I were talking before this started. Flexibility is key. We had a saying around here, perfect cannot be the enemy of good. And I think one of our goals in adapting is to carry that forward, once again, with safety in mind. I just think Dayton's history of invention and sheer determination was demonstrated over and over again. My learning, my company's, was that you cannot sit around and wait for others, and frankly, in some cases, the government, to solve your problems that are here and now. And I saw so many examples. I'm sure we could talk at length. But one was this idea of PPE. I even think the public knows personal protective equipment. The shortage was very real, and despite a robust multi-level sourcing, we had to be once again innovative. We worked with UD Research Institute and Fastlane, which is a company, an industrial products company out of Piqua, to produce gowns. And that may sound simple, but I would remind people that healthcare is extraordinarily regulated, and it's not, it was a very challenging design. Same with face masks, etc. The other big thing is, and everyone has heard about this, is testing. Key to intervention and spread of the disease is testing. I think it's no secret that Ohio has been somewhat, criticized for not being able to test. I believe our partnership with CompuNet Clinical Lab, which is a regional commercial lab with tremendous depth and expertise, we went, I think it was March 17th, we went with UD and opened one of the first testing centers in the state. And over a matter of a couple weeks, we went from capacity to do 100 COVID tests a day to over 1,500. And I think that will continue to require ongoing adaptation, because we are not there, despite being one of the first in the state to do testing. I think being innovative again, first to do plasma therapy, first to do the antigen test, and I won't bore you with all the clinical, but having the, connecting with the right partners rapidly to innovate, I would say, is an ongoing theme in this crisis. And then just lastly, I would like to say something that I think when we talk about all these various issues is the need for us to work with our community. I would just like to take a moment to say it would have been impossible for us to stay the course without the incredible outpouring that this community gave us. We had over 900 people volunteering to make the lower acuity level masks at one point. I think they've made something like 10,000 masks, which was huge. The partnership I mentioned made over 1,200 gowns. It is such a marvel to me that restaurants and others that were hurting saw their way to donate our healthcare workers food. We had over 500 meals donated. Our partners in Sinclair, Wright State, and UD called. Penny called. They had masks. They all stepped up, and it's dangerous to name people because the list is so long. So I think in terms of ongoing adaptation and getting through this until and I don't believe we'll really be through till there is a vaccine, the word of partnership, innovation, nimbleness, and open-minded are hallmarks of success and what we need to do collectively going forward. So thank you.
That's really great, Mary. Thank you for your leadership and for recognizing the community's efforts. And a personal thank you to you and your team. You guys were personally involved, you yourself and your team, in helping advocate for more reagents for the COVID-19 test for this community, and that was extremely important for all of our businesses and our residents in this community. So thank you very much.
Thank you.
I want to turn it over to Debbie now. Debbie Feldman, President and CEO of Dayton Children's Hospital. Debbie, a few opening words.
Thank you, Chris. And before I begin, I also want to thank you for your remarks regarding the challenges we have related to racism. We know that the impact on the social determinants of health and certainly on the impact on children of racism is dramatic. Our chair of pediatrics, Dr. Dubey, wrote a piece that is on our website about racism as a socially transmitted disease and how it begins to impact children's health at the youngest of ages. And I recommend anyone who's interested to take a look at that. I also want to congratulate you, Chris, in your new role. I know many of us expected that you would step into this role because you've done such a fabulous job at the chamber over the years. So congratulations, and we are very lucky to have you leading us during this time. Mary did a fabulous job, I think, of providing an overview of what's happening not only at Premier, but I think in all of our healthcare institutions. We have had to really change the way we practice medicine in a week or two. It's just been dramatic. The change, we've all been dealing with change in healthcare. We know that healthcare is going through, as an industry, dramatic change. But the pace of this change, the breathtaking quickness of how we had to pivot was really, unprecedented. I know that word has been used so many times, I hate to use it, but really the change has been unprecedented. The move to virtual visits, as Mary, spoke about, has been incredible. It'll be interesting to see how it continues to play out. I can tell you that some of our physicians think it is wonderful and others do not. Some of that may have to do with their age, but some of it is just really their specialty and their need to actually, lay hands on a patient versus being able to have that conversation. So, we've been spending some time after that initial ramp up to really begin to optimize and think about, how do we integrate the virtual visits. Frankly, in some cases, they are not as productive as physical visits. Our families aren't always prepared when we knock on their virtual door. And, we've had visits from Walmart, frankly, we've had visits from cars, and we've had visits in, kitchens where they're set up and ready to go. So we're really working on that optimization of the virtual visits. You've heard a lot that children's hospitals and children, thank God, have not been as dramatically impacted by COVID-19. And I know we are all thankful for that. I can share with you that we continue to see that. We, along with all the children's hospitals, are testing both asymptomatic children who are going into surgery as well as children that have been referred for any kind of symptomatic testing. And we are still seeing extremely low incidence of the disease in children. And that is a really important information that we'll be sharing with the state and our local school districts as they start to make decisions about how they move back into school. We know that from a business standpoint, our children going back to school is extremely important, not only for our future workforce, but for our current workforce who have children that they need to have cared for. And school, of course, is an important part of that. We're seeing really less than 1% of asymptomatic children testing positive. And that is data from all the children's hospitals in the state of Ohio. But as a organization, as a business, we were hit very hard by COVID. We were hit just as hard as our adult hospitals from the standpoint of the loss of business. And we also anticipate that loss of business will come back slower because our families are maybe more willing to have health care for themselves, but a lot more concerned about the impact it could have on their children if their children were become infected in some way by the virus. So we've spent a huge amount of our effort trying to convince families that it is safe to come back to Dayton Children's and get the health care they need. We are worried about the drop in vaccinations and the impact that's going to have on children. We are worried about the drop in child abuse that we have seen in terms of reports, and unfortunately now we are seeing the result of that in the most recent case, of course, of the baby that died recently in their home from what looks like non-accidental trauma, and we worry what else is happening in the homes. We are concerned about the long-term impact of the health of children, and we know that it's important for Dayton Children's to remain strong to meet the needs of our community. So we continue to try to adjust to this environment we're in. We say that we are living with COVID. Now we are no longer responding to it, but we are learning to live with it. And we are starting to see, I think, some positive results of that. So we continue to try to support our families as best we can. Our employees have been unbelievable. As Mary said, they are the true heroes of what we are dealing with. The staff that we have had on furlough have who we have continued to pay, even though they are on furlough. They are desperate to get back here and do what they do best, which is to take care of children. The generosity of the community has spread through all of us, and Mary shared that. So as we move down this path, we're going to have to focus even more of our attention on these social disparities of health, because we know that many of our children who are at risk are even more at risk for healthcare issues now than ever. So I'll stop there and just say again, thank you to the Chamber for having this event and letting us share the impact that all of this has had on our kids and our families and all of us in the community.
Thanks, Debbie, and thanks for your kind words, and thanks for your leadership, especially on the child care issue. I know that you've been side by side with the business community on helping to advocate to the state leadership on how important it is to have adequate, good child care that is accessible to our business community. So thank you for all that. Next, I'm going to turn it over to Fred Manchur. Fred Manchur, CEO of the Kettering Health Network. Fred, thanks for being with us today, and I will turn it over to you right now.
Well, thank you very much. And again, welcome to all that are listening. I must say thank you to Mary and Debbie for your sharing words. The nice thing about being last, you can just say they've covered most of y'all. Thank you so much. I would like to say that we need to first, at least I would like to recognize our governor for acting as quickly as he did, making the moves that he needed to make. And even though sometimes it was frustrating for us, some of us in the field, he has proven that he has done the right job. And we've been blessed in this state, and especially in our community, we've been richly blessed. I think that, again, our mayors in the various areas that we serve in, I can't thank you enough for supporting us. And again, each Gadaha, of course, has come through. And I think our organization shows that we're very collaborative. I must say, we got to know Mary and Debbie even better, and her team, and we respect each other, and we are willing to work together. This separates us from a lot of the other communities out there. And I must say, the community here is very fortunate to have both Premier Health Partners, Dayton Children's, and of course Kettering. And so with that, we were fortunate to have the National Guard step in and work closely with us. They helped us plan, because part of it is planning and looking at how can you achieve what you need to achieve working together, but having a government involvement. I must say that, again, you know, we look at our government, yes, they are there to support us, but we also have to plan. I mean, you remember we've gone through Ebola, SARS, all the different areas. We have supplies. We are ready for this, for these types of situations that arise. Did we have all that we wanted at that time? No, we had to keep planning. We had those vendors that worked with us and continue to work with us. And so again, I think as a community, and especially at Kettering, we were blessed. We even shared, we had to share in Washington, D.C. We shared in Cincinnati the supplies that folks needed to have. When you heard about the Abbott machines that were out there and that could do the tests in 15 minutes, you got to understand, we're geared for outpatient. Our facilities, we're over 60% of our volume, and we have a very strong inpatient volume, but we are really focused on spreading our wings and out in the communities. And so we already had at least 30 of those machines out there, and we were looking for the reagents. That was our biggest challenge, was reagents, so that we could have the test kits so we could make that happen. But that came through too, and that's again through relationships. I must say that our command center, we have a command center here that's second to none. It's like a Nassau command center. We've been doing this for a number of years. You have to realize that with our outpatient services, we operate transportation probably 200 to 250,000 miles a month in bringing folks through to our campuses out of our 11 counties that we serve. So all we did is we refocused our command center to make it an incident command center at that time, and we regrouped and went right forward with our teams. We brought our teams together and continued just as we had been going on as we went along. I know there's a question of saying, okay, you know, this pandemic that's there, and as Debbie said, it is definitely unprecedented. But I want to reassure that the key here is for the community to know that each of our facilities, we are safe. In each of our facilities, we have isolation rooms. We already have isolation rooms. So as we go forward, when you start thinking to yourself, well, what are they going to do when they start closing down some of their wards or some of the areas that we were using for backup? We still believe in isolation rooms, and we still have them available. So I want the message out there that we are safe. You need to come in. What we found through our vascular surgeons is that so many were not coming in. So now we're having to remove limbs. I mean, you know, these are situations should never have happened. Folks that have heart challenges, you need to come in. I mean, do come in. Where would you have anything safer? We're at the front end of safety with regards to how we care for our patients. So if there's a message out there, I'm telling the communities, please look to us, each one of our facilities, not just Kettering, each one of our facilities, come in and get cared for. Do not stay at home. Early detection, the amputation levels will go down, your healing process will be sooner, and your recovery will be there. So please make sure that you come in. I think the greatest challenge, one thing was going down, the next thing was reopening. And reopening is really an incredible challenge for us. And as Mary and Debbie pointed out, we've learned a lot. We've learned how many folks that we could have at home and doing work and using our electronic capabilities. And so right now, we're having to regroup and rethink what kind of volumes are we going to have. We will not be the same. Each one of our institutions and organizations will be different, and we will have to provide care. We will still provide the same care, but again, many times we'll be doing it through telemedicine, through our physician offices. And when those that cannot get in, they need to at least call in. They need to be communicating and connecting together. So if there's anything I can emphasize more is to please trust us. We're here for each of you out there in the community. We, as you talked about the situation that took place here just a few days ago with George Floyd, that is just heartbreaking. I mean, literally heartbreaking. We had last night, we had not only distanced ourselves appropriately, size-wise, where we had a healing conversation with those of our employees that have that concern. Where is this community going? How can we help this community? And so we had it online, and those that were able to attend, we had it limited to the space that we had available. And I want you to know we are a faith-based organization, and I know this is a faith-based community. We believe in prayer, and so at the end of the day, there isn't a meeting that doesn't go forth that we don't include prayer in that. And I know that each of our organizations here, each of the facilities in town, Premier Health, Dayton Children's, we look at at a higher calling. We look to a higher calling to make sure that we definitely ask for assistance, and that's what we do here. So remember that it's family. It's faith, family, and work. Faith, family, and work. And put that in that order. And do trust us. We are there for you. And if there's anything we can do, we're ready to assist in. And so please ask us any questions that you have. And if I don't have the answers and the team doesn't have the answers here, we will find them for you. God bless each one of you out there. Thank you.
Thanks, Fred. Thanks for those words, and thanks for your leadership, even on the PPE issues. You guys have really been a great partner, and we appreciate that. And I appreciate everybody's comments, but we're already starting to get a couple questions in. And so, Fred, don't go far, because the first one I'm gonna throw right back at you, because you led into this in your comments. So it's relevant for me to address this now with you. But you talked about how safe these healthcare facilities are and how important it is for people to come back in. All of the networks were prohibited from having elective surgeries for 2 months, and we all know that these surgeries provide revenue to our area hospitals and help offset community health care that all of you administer. Kettering Health and other networks are continuing to do a tremendous job to step up and serve the community during COVID-19. The question is, will the hospitals be able to continue to be able to provide this type of dedicated service for the business community and the citizens of the region? Fred, that's for you.
Yes, thank you. Of course, we will be providing those services. When we were asked to close some of our services, that did impact us financially, as it has impacted every business in this community. There isn't anybody that hasn't been touched. Our volumes dropped at least 50%, and sometimes even more, depending what area. And again, we were blessed. You know, it's something that you can never fully prepare for, but you have to have sound financials to sustain this. And so we were blessed with that. The other side of it is, can we continue serving as the community would expect? Absolutely. We are there. We have everything that you need, and we are open for all services, even in the I think where the information broke down, the communication broke down, is that if you had, even in the outpatient scenario, I mean, many of our orthopedic cases, if not most all of them, are outpatient. When you have a broken limb, we have a patient come in with the bone sticking out. I mean, you talk about, and this happened, and this is not, and for days at home, that's a problem. I can't instill more to each of you that are listening or seeing our comments here. Come in when you need to be cared for. We'll tell you whether you have that procedure done now or you'll have it done later, or that surgery now or later. But do not hold back. You come in and we will guide you through this process. Each one of the organizations that are here, come into us, come see us, come. Early detection, early reaction.
That's great, Fred, and I think we have strong confidence in our entire healthcare system, and we know that you and your colleagues here on this call have tremendous healthcare available to all of us, and we need to be getting in to ensure the health of every single one of us when we need it. So thank you very much.
Hey,
Debbie,
Chris,
I want to, yes, ma'am.
Chris, I'm sorry, I just wanted to piggyback, and I appreciate
Sure.
Fred emphasizing and Debbie, I heard you in another seminar. There is in Ohio, by statistics, probably some overutilization pre-COVID of an ER. Some things can be in an urgent care, some can be in your doctor's office. But what none of us want is people, if you have symptoms of a stroke or heart attack, to not address those. Early intervention is critical in clinical issues. The other thing, just to share, and I think sometimes people in other businesses may not realize, the margin in not-for-profits is break even to single digit. We're not a stock held company. And just by way of data, because I've been asked this by various people, they hear about the federal stimulus dollars and presume we're all just fine and we were taken care of as not-for-profits financially. We appreciate those dollars, but Ohio hospitals to date have lost 3.1 billion, that's billion with the B dollars. The federal CARES dollars have amounted to 1.3 billion. So yes, the governments are challenged. Yes, other businesses. But I think it's important for people to know that leaves a $1.7 billion gap. And just like the recession, you know, we're going to provide care. That's our mission. But it's going to take time to dig out financially. We used to be recession proof. I don't believe that's true any longer. And this is a perfect example of that.
Thanks, Mary. Appreciate your additional comments there. Debbie, next question is to you, and we talked a little bit about this, but it's come up again regarding childcare. The business community wants to bring people back to work. But given the current childcare limitations because of COVID-19, some employees just can't find childcare. Essentially, this is forcing employees to choose between family and work. And we know where people are going to choose. They're going to choose their family. Can you talk about the immediate effects of these limitations on the business community and the long-term effects on the childcare industry in the region? And then what can we do as businesses to try to help address this challenge?
Well, Chris, you definitely bring up what is going to be a serious long-term issue to the business community if we can't figure out a different way to address it. So, as you know, child care centers were shut down for the most part during the response to COVID. We did have about 70 providers that stayed open as a pandemic care center. Dayton Children's was one of those, but they operated about 50% of their capacity. And so now with the opening up again, those same rules with a few modifications have been put in place. Most of these providers operated on a slim to no margin to begin with. And with this restriction in the numbers, not only are they able to take fewer families, but they have to increase their rates. And many of our employees could barely afford the rates as they were. So there is some money that has come from the federal government through the state to assist with the financials for child care centers through August, but then that is going to go away. And there is a national statistic or prediction that about 30 to 50% of child care centers will close as a result. If no other intervention occurs, they will close. They just simply cannot afford to operate at about half of their capacity. So it's not only under normal circumstances with childcare, there's ratio limitations, one provider per X number of children, but it's the limitation in the room itself. Right now, no more than 9, for example, for toddlers and above. So you can really only have 8 children, regardless the size of the room itself. And so this is a serious, serious problem. Our childcare workers, average salary for a childcare worker is $11 an hour. So they are on the front line here, and they are, frankly, more exposed in some cases, and they are now being asked to work at the same time be concerned about their own health. I did speak with, many of you know Robin Lycap, who has been really our leader in this community when it comes to childcare, and she shared with me this story, and I think that it's representative of a lot of our own workers and many of the folks who are listening, workers. This is an example of a single mom. She makes $15 an hour. She was barely able to afford her childcare prior, but she is now, her childcare costs about $10,000 a year for her right now. So think about that. She earns $15 an hour. That's about half of her take-home pay, and her provider is telling her they're going to have to increase her tuition in order to remain open and take her child. So she's really now being forced with exactly what you said, which is, does she quit that job, or does she, take care of her, take care of her child, or work and have no safe place for her child? So as employers, I think we're really going to have to grapple with this. First and foremost, we need to really advocate with our congressmen and senators to provide some sort of federal assistance to childcare. The county, I just want to recognize the county. They did step up early on and provide some assistance to our childcare providers through tuition support, and that really helped. But that was over by at the end of May. So I know that our commissioners are looking heavily at this and seeing what they can do from a local standpoint with money that they've received. But we can't solve this locally. So first and foremost, we need to advocate for more federal assistance for childcare. And then as employers, we need to think about how can we help our own staff afford childcare and be flexible with them if they can't afford full-time childcare. This is really, really a serious problem if childcare cannot return to its normal capacity. There is mixed scientific evidence on this. I do want to say that the restrictions are not out there, just because they're out there. There is mixed scientific evidence. There are our own infectious disease leaders here at Dayton Children's have done a lot of research on this. There are some that believe that children can return safely to normal childcare, and there's others that don't. It's very hard to ask a 2-year-old to wear a mask. It's one thing to ask, our 6-year-olds and above in school, but to ask a 2-year-old and a 3-year-old to wear a mask. I have a 4-year-old grandson, and he doesn't keep that mask on very long. So these are some of the challenges, and I know everybody's concerned about them.
Thanks, Debbie. Mary, I want to go back to you. We had a question come in regarding the business resources Premier's been providing for the business community. You've had some great resource guides that have helped businesses reopen. Employers want to provide the safest work environments possible, but they know they don't have the healthcare expertise to do this. How can our hospital systems continue to assist, and what role can they continue to play in helping those employees come back to work?
Thanks, Chris. I think all of us would appreciate, because every business has some unique aspects, reaching out. We have a home health division, Fidelity, that it has over 1,000 employee contracts. So I think oftentimes it's best to visit that business, or even if you have to do so virtually, and understand what those needs are, and we can get the clinical resources. We just again partnered. Eric Spina doesn't let a lot of grass grow, so he's already started a medical panel, and Wright State as well as ourselves were able to offer suggestions. I appreciate my colleagues emphasizing, and I want people to know, sure, we care about the revenue, but when people don't get care, that's a margin of error that's not always a good one, because you're dealing with human lives. So I think when in doubt, people should err towards, whether it's an ER, whether it's contacting around employee health, reach out. We all have divisions that can provide very detailed analysis and information, and we have ways to do that. I don't have an 800 number or an email, but you can visit our web pages. We're very happy to partner. I think us doing things like this, we as a philosophy of our board, which is, community citizens, it is an expectation that we all be involved on community boards. Because we consider ourselves a community asset. And you've heard the theme of partnership here today. I think that's the best way to resolve new issues that will pop up as a result of this pandemic as we go forward.
That's great. Thank you very much. We've got about 8 minutes left, so I think we have time for another question I want to throw out there to the group. And Debbie touched on this a little bit, but anybody's welcome to answer. There's an anticipated surge in mental health issues that could happen coming out of COVID-19. And obviously mental health is something that is worrisome for all of us, that we need to continue to address in our community. Is there a plan? Is there a healthcare plan on how to try to address those mental health issues for our community, especially if we see a spike in them coming out of the pandemic?
I'll say a few words and certainly then turn it over to my colleagues. But, you know, prior to COVID-19, suicide was the second cause of death amongst teenagers. We have seen a crisis in pediatric mental health issues that has been building over the last number of years. And the isolation that a number of our children are feeling right now, the anxiety that our children are feeling, there is no doubt that there is going to be a long-term impact. We are ramping up our virtual approach to that as well, and our psychologists and therapists have remained active throughout this event. But we know that we have not really begun to see much of this. Again, from a pediatric standpoint, children, much of these things show themselves in school. And so when children are tucked away, we don't really know what's happening with them. We know from our conversations with the Dayton Public Schools and other school systems who have been doing an incredible job of reaching out to families and kids, some of these children they can't even find. They don't really know what's going on. We really don't know the impact. And so we are extremely concerned, and we are just trying to ramp up all the services we possibly can, not just at the hospital, but out in the community, in the schools when they open, to try to reach them. And I know the adult situation is just as challenging. I'll turn that over to Brett or Mary to address.
Well, I would say that we do have a 60 bed facility independent of our hospitals. We do have a strong support system there for counseling, and we're continuing to do that. And as our psychologists, psychiatrists, our counselors, we are preparing for whatever may be coming forth. I mean, at this point, you're absolutely correct. With regards to those that have been staying home, there are a lot of challenges out in that field, and we've not been seeing them come in at the same level as they have in the past, which means there is a built-up demand. So we'll do our very best to support and have the resources to manage as best we can.
And just to piggyback, I know you're getting out of time here, Chris, but we've all talked about the loss in business with the governor's appropriate stoppage of surgery and elective surgery. Interesting, we've run Samaritan Behavioral Health for many, many years. It's been the crisis line in this community. And that was one service, just perhaps a reflection of what's going on, that their business actually went up, their demands. And it's so reflective of the need. I don't know if my colleague, I think Marty Taylor from 115 is on the line, and the concerns, you know, we all have partnered with 115. Samaritan Behavioral Health is the operating partner. The concerns for the what the impact on addiction and, you know, mental health, what's occurred, and it's been very difficult to, you know, the numbers aren't final, but it's not where we want to be as a community. And I do think on this mental health, it's got to be all of us, because there's so many aspects. Even when you think about, there's a lot being written about physicians and their burnout and other caregivers. You know, I think we in the business community like to open meetings with how hard we're working, but just imagine yourself. I guess I'm probably sensitive, having been a former critical care nurse. I think I'd probably be dangerous now, but wearing gowns and masks and gloves, taking them on and off. We're in the summer season. This is not easy, and it gets extremely fatiguing. So we've got our own internal you know, groups of people to be very cognizant of their needs. So lot more questions than answers. I appreciate the statement and the acknowledgement.
Well, thanks to all three of you. We're gonna wrap things up now because we're running out of time, and maybe I can give everybody a couple minutes back in their day. But I want to say thanks to our three great leaders, Fred, Debbie, Mary. You guys have, we are blessed in this community to have such tremendous healthcare networks and to have advocates like you that not only are businesses and our competitors, but are advocates and supporters of the community. And we truly appreciate all that work that you do. And even more importantly, we appreciate the work that your staff does. Your staff is the frontline workers. They're the ones being exposed to COVID every single day, and they're doing it with community healthcare in mind, and they're doing it because they love their job and they want to help make people better. So thank you to your teams and for all the work that they've done. As we wrap things up, I just want to thank our sponsors again: CareWorks, Benefits Network Insurance, and Pickrell, Schaefer, and Epling. Thank you for making this event possible and for making this a complimentary event for our members. Appreciate all you've done. Also want to remind everybody that the Dayton Area Chamber of Commerce launched a e-commerce PPE store exclusively for our members. So any businesses or healthcare organizations that are on this call and you need PPE products, the Chamber was able to get work out a deal with a local company where these products are being warehoused and can be delivered to you within a few days. So we know how hard it was to find masks, gowns, hand sanitizer. We were able to use the collective power of the chamber membership and buy some products and shelve them, and we can get them out the door to you immediately. Just go to the Dayton Chamber website at www.daytonchamber.org, and that PPE store is right there and available to be shipped to you immediately. Thanks everybody for joining us today. Thanks for your commitment to the business community, and thanks to our great healthcare leaders. Everybody have a great weekend.